So welcome everybody to another Women in THR webinar. And today we are joined for the first time by Dr Marewa Glover, who is a director of the Independent Centre of Research Excellence, the Indigenous Sovereignty and Smoking, and a smoking cessation expert. So we're really excited to have you on today. Thank you so much for joining us. I actually met you, Marewa, for the first time at the Global Forum on Nicotine in Warsaw back in June, and I thoroughly enjoyed your talk on academic freedom. In fact, if anybody still wants to see her talk, there is a recording of it on the GFN website, and we'll actually link that below the description box beneath the video. So thank you very much for joining us. So my name is Jess, and I will be joined very shortly by my colleague Ilna, and we represent a platform called tobaccoharmreduction.net. And it's this platform who is hosting the webinar today. So Marewa, I would love to start by asking you if you can tell our audience a bit about yourself as a person so we can get to know you. So you have a very interesting story to tell, and we'd love to hear where you are from and also your educational background and how you came to be such a prominent figure in this THR space. So over to you.
Well, thank you, and thank you for having me on. And well, I've got kind of a very long career now, so it's too much to cover, but I actually started working when I was 16. So I didn't do sort of the higher college years. My parents had paid enough, apparently, and out I was. So I've done so many things in my life. I've done bar work. I worked in Europe on camping tours as the cook. So I have been able to see quite a bit of Europe at least, and some other parts of the world. But, the thing was that I did meet a lot of people who were troubled and had issues. And I really felt that I wanted to do something to help people. So I wanted to become a psychologist. And I went back to university. I went to university as a mature age student in my 20s and studied psychology. So originally I thought I would become a clinical psychologist and do counseling. But I realized that it's better to try and prevent these problems from occurring in the first place. So what about going further upriver and stopping people from falling in and floating down into the depths and doldrums of depression and suicidal ideation? So I moved my focus more to prevention, and I ended up going and working in community health and became a director of a community health centre. And this was in rural outback, kind of outback Victoria, Australia, so very interesting. And I was introduced to the challenges for Aboriginal people in Australia using healthcare systems and the racism they were facing. I ended up coming back to New Zealand, continuing my university education, trained as a community psychologist, wanted to learn how the government works, so went to work as a policy analyst, and that's what got me into reducing smoking and the prevention of smoking-related harm. So my focus has always been on reducing the diseases and premature deaths associated with smoking. I don't think I was ever a prohibitionist, although in tobacco control, and I've been working on this topic for 30 years, it's a very kind of influential bubble, like as long as you're all agreeing, it's happy families. But eventually the work that I had done identifying public health priorities for Māori and working around the country, Māori people never said that they approved of taxing tobacco because it hurt the lowest income groups, and they were overrepresented among the lowest income groups. So I became uncomfortable with some of the positions that tobacco control was taking as the tax went up and up and up. And in New Zealand, we now have the highest tax, the highest price tobacco relative to income, if you look at relative to income. So, now the tax is so high, many of the poorest people who have proportionately the highest rate of smoking, they can't even afford to buy it anymore. They're forced into really, pulling apart cigarettes and rolling tiny wee little skinny racehorses and making it go as far as they can. And you know, some people even pick butts up off the street. And I think that's really dehumanizing behavior. And I became very, very uncomfortable with the way tobacco control was going. And yeah, so, and I think you're going to ask me about some of the other work that I then have done.
Yeah, so I was actually just going to ask you about your current working post. I think that's really, you know, drawn us nicely up to your current role as a director of the Centre of Research Excellence. And what are you currently working on?
Currently, we're looking at the facilitators and barriers for people who don't want to quit or don't believe that they can stop smoking, and what helps them switch to vaping and or to quit, and what's getting in the way of that. So I have, you know, reported on a little bit of that, but we have a cohort of, we started with 62 people 2 years ago, I think it is now, and we're following them through. So we're going to be able to paint that picture over a longer period of time, not just, you know, it's not cross-sectional, and it's deeply qualitative work. We interview them in a very sort of open conversational style, and all of the results as such, or the raw results, written up as a case story, and we put that on our Voices of the 5%.nz website. So it's Voices of the, that's all words, number 5, and then percent is a word, .nz. So we now have all of those case stories. The baseline interview is up, and the follow-up, first follow-up interview is up, and I'm now writing and editing the second follow-up stories. So you can follow people through, and this is important because New Zealand is going through some rapid sort of changes in our smoke-free laws, very rapid, what people think is very radical, but not in a good way necessarily. Some people obviously think it's fantastic, and I'm very concerned about the negative effects.
We'll definitely link that site below so people can read those responses. When do you think that will end? Do you plan multiple follow-ups so we can have the complete picture?
Yes, we will be following them through, and then as you know, we've got another law change coming through, but we've already had the vaping regulation go through, and then no sooner had that gone through and the government said, right, now we're going to do another amendment. So we've had a few amendments occur while we've been conducting that study. The second issue we'll be focusing on and getting the information from those people is what they believe about nicotine. So really looking at this nicotine misinformation that's just exploding around the world, and you know, even people who are quite smart getting totally sucked in by these lies. So we're looking at that as well, and that will be another paper.
Yeah. So you did mention that I would like to ask you about your previous work and research that you've done, which has been incredibly important in the tobacco harm reduction space. So the website for the Independent Centre of Research Excellence, where you work, states that reducing smoking among pregnant Māori women has been a particular focus of Marewa's research. So can you tell us a bit about this particular project? How did you go about it, and what was the most important finding from your perspective?
Well, I guess that I have been working on that topic again since I did my PhD and graduated in 2000, so 22 years ago now. But my PhD was looking at an Indigenous intervention, a stop smoking intervention, and very few pregnant women were involved in that. And then in later cessation interventions that I was involved in rolling out or training people, very few pregnant women were enrolling. So I wanted to specifically look at that. At the time, about 62% of Māori women who were pregnant smoked, 62%. And I felt that they really should be the #1 priority group for all of tobacco control and smoking cessation, because of course they're pregnant, there's immediate harm to their, their baby. And So I made them my first priority to focus on, and there was very little research, even around the world, on helping pregnant women to stop smoking. And yeah, so I've done qualitative work, I've designed interventions, I trialed the use of incentives, like, giving women vouchers or gifts, just a lot. And even with my centre, which was funded by the Foundation for a Smoke-Free World, I put in my program. So it was all my ideas I put forward as a proposal, and then they funded, my program of work. Included in that, one of my first studies was to design like mini ads, like they're like 3-minute long, and it's a story, it tells a story. So each ad follows a young woman getting pregnant and how her whānau and family all react to that. And what we tried to test there was the use of humour, because pregnant women experience a lot of judgmental, nasty, people would abuse them in the street. If you're pregnant in New Zealand and you smoke in public, members of the public think that they have the right to come up and abuse you for that. So it made it hard for them to raise or to be honest about the fact that they smoked. So they weren't getting cessation advice. They didn't want to tell anybody because of the judgmental attitudes. So we tested the use of humour. And of course, humour is very culturally based. So, and that's on our website and our YouTube channel, those ads. That was a very interesting project.
We'll make sure we link that below as well, so people can read about that. I think that's fascinating. So on this topic of pregnant women, so I myself had 2 children, and I had friends who were pregnant at a similar time when I was pregnant with my daughter, and 2 of them were smokers. And when they actually were speaking to the midwife, when they found out they were pregnant, both midwives actually suggested they vaped. So in England, obviously that is so, and they did vape throughout their pregnancies, and everything, luckily, was fine. But it's interesting that midwives are actually suggesting that they try vaping, and they did, and it was a success story from their perspective. So, I mean, what's the current situation in New Zealand now? Would a midwife recommend that you try vaping if you can't give up smoking? What would be a common experience in New Zealand now if you found out you were pregnant in that respect?
Well, some of our latest studies, definitely some pregnant women are vaping, and it's really mixed among healthcare workers. Some have been completely sort of duped by the misinformation and lies about vaping, and they wouldn't recommend anybody vapes. And then others understand, so we do have probably a majority are on the same page as you are in the UK. And obviously the Ministry of Health and our politicians support people to use vaping for smoking cessation. And whether or not people openly say, even if you're pregnant, but that's another one of my papers that I did with the help of Dr. Carl Phillips in the US, and we did a systematic review looking at the effects of nicotine while pregnant. And, our conclusion from that is, well, a lot of the studies are just they're just poor. And you have to be very careful when you're reading research, make sure that it is actually robust, and unfortunately leave the rest of it out. So we concluded from that there is no good basis to deny women the use of risk-reduced products, especially if they're pregnant. It's far better they don't smoke, and they use a risk-reduced product if they can't stop altogether.
Yeah. Does Ilna want to say anything? I'm kind of taking over here. Welcome to come in later on, Ilna, with any questions you have. Or should we?
Yeah, not at all.
Yeah?
I'm just enjoying the conversation. It's lovely to meet you, Marewa.
Yes, hi.
Cool. So my next question is about, so you as Professor of Public Health at the Massey University, so prior to establishing the centre that you're currently working or director of, You were a professor of public health at the Massey University and chair of End Smoking New Zealand, a non-government organisation that has advocated for a harm reduction approach to reducing smoking. And you're also a finalist in the New Zealand Women of Influence Awards in 2017, recognising your high profile as a public health commentator and advocate. So congratulations for that. That's a huge achievement. And can you tell us what one thing or your team did that created the most change or impact during this period of time?
I will. And after the Women of Influence Award in 2019, I actually was one of 3 finalists in the whole country for the Supreme Award of New Zealander of the Year. So that was just an absolute honor. And that was an independent group that ran that award, and they wanted to recognize what I had done to have vaping accepted as a harm reduction approach to helping people to stop smoking. So how I got to that was after the Global Forum on Nicotine in 2015, I spent a lot of time listening to people who vape and asking them questions. And I came back, I visited the Ministry of Health to share what I had learned and suggest that we really seriously need to look at allowing vaping to be used as it is now. I did a lot of radio, TV interviews, seminars on vaping, just really began to try and educate as many people as possible. And in my role as a professor at a university, you know, I had the credibility and standing and position and the help of the university media people to get that much coverage. And it was quite controversial, I guess, at the time, but it became far more controversial once the prohibitionists and anti-vaping people realized that vaping was out the gate and they better do something fast or it would get in, and it got in.
I also want to mention briefly the lobbying that you have done in the past when it comes to snus products in New Zealand. So we're actually going to be running a snus event, well, a Swedish experience event in Sweden at the end of the month. So at the moment, we're kind of knee deep in oral nicotine, etc. So I thought that was quite fitting for where we are at the moment in our campaigns. So you were lobbying for snus products to be legalised in New Zealand back in around 2015, if I'm correct. Can you give a brief update to our audience regarding what the current status is of these products in New Zealand?
So actually, End Smoking NZ probably lobbied for Swedish style snus to be legal in New Zealand for about 10 years. So it was a long effort trying to educate people and let them know about what had happened in Sweden. You know, there's like over 30 years of epidemiological evidence proving that they're a harm-reduced product. And we'd always been told right back 30 years ago when I began in working on reducing smoking, we were always told that snus was illegal, it was already banned. Well, an interesting thing happened when Philip Morris launched their heated tobacco product in New Zealand, and Ministry of Health took them to court, and under the same part of the law tried to say that the heated tobacco product was illegal, the heat stick. And the judge threw the case out and made a couple of really startling points. He pointed to wording in the law that said oral tobacco products intended for chewing were banned, intended for chewing. And of course, Swedish snus, the small, you know, tea bag of powdered tobacco, pasteurized powdered tobacco that people put up under their lip, is not intended for chewing. And I was like, oh my gosh, it wasn't illegal all that time. And it really taught me you have to be careful of what government says. They will tell everybody their interpretation or what they want people to think the law says, but it very well may not say that.
And talking about government, that moves me nicely onto my next question about New Zealand's fairly new smoke-free generation law. aka the Smoke-Free Environments and Regulated Products Amendments, also known as. So it's an attempt for the government to raise the legal minimum sales age so that teenagers will never be able to legally purchase cigarettes, and anyone born after a certain date, and will never be able to purchase any tobacco product, but vaping will remain legal. So as well as the shifting smoking, they will dramatically reduce the nicotine level in cigarettes and force them to only be sold through specialty tobacco stores rather than corner stores and supermarkets. This law is expected to come into effect in 2023, and the rules target only tobacco products, and vaping will, like we said, remain legal. This is important because it is seen as innovative and progressive, and it's likely that other nations will potentially adopt similar measures, the US, etc. So if this law gets fully implemented, there is a concern that it will get duplicated around the world. And we know that attempts to do something similar with the minimum legal sales age has actually been attempted in the States, but did fail. The concern here is that if you're doing this with cigarettes, then will similar laws be applied to vaping in the future? Because as we know, vaping can tend to follow the laws and rules for cigarettes. Probably a good time to ask you, Marewa, to come in and to provide your insights and wisdom, as I think this was relatively unexpected for the THR advocates in New Zealand. Would you agree?
I just want to go back to SNUS for a moment, because you did ask me about the current status, and it is relevant to the question you're asking me about this new proposed law that's being rammed through, regardless of what anyone says. And so the Ministry of Health versus Philip Morris case that showed that actually there was a little bit of a hole or a loophole in the law. When the vaping regulation was put through, the prohibitionists succeeded at having snus banned in that vaping regulation. So in black and white, oral nicotine products and oral tobacco products were completely banned for you. You're not allowed to bring it in and sell it in the country. You can bring it in for your own use, but you'll be paying very high tax on it. So if we were going down the harm reduction approach, we wouldn't have done that, because the oral nicotine products that just have the pouch, cellulose fiber, no tobacco and nicotine are even safer, although vaping is, way safer, like 95% safer than smoking, but the oral nicotine products are like 98% safer. So actually, New Zealand is not fully supportive of a harm reduction approach to reducing smoking. Yes, vaping was legalized, but it's only been legalized to use it for smoking cessation. And that law, it's embedded in the law that once they get everybody off smoking, then they'll go after vaping. So it isn't assured that vaping will not be banned later on. Coming to the new proposed law change that is the current government, who have a majority, are planning to ram through before Christmas. The smoke-free generation part of it is really virtue signaling. It's a damaging attack on adult autonomy, but it's a distraction. The real kicker, the real nasty punitive part of that law is reducing the nicotine down to such a low level, it will not work anymore. The level of nicotine would be like 20 usual strength cigarettes. Nobody's going to sit there, neither could they afford to sit there and smoke 20 cigarettes in one go. So that is, by all accounts, prohibition. That is banning the smoked tobacco. And I'm very concerned about people who have a high dependency. That includes some people who have mental health conditions, particularly like schizophrenia, anxiety disorder, depression. There are particular mental health conditions that smoking, people use it to alleviate some of the symptoms of those mental health conditions. So what's going to happen to them? And this has never been tried anywhere in the world. Policy should not be passed where there is no evidence to indicate what's going to happen, whether it's going to work, but worse, what are the negative effects going to be? The other really punitive and intentionally punitive part of the law is to reduce the number of retailers that can sell the remaining products, even if they have hardly any nicotine in them, from about 8,000 in the whole country, a country the size of Japan. We only have 5 million people, but we still have a country the size of Japan. And we have about 8,000 now who can sell cigarettes, and that will be reduced to, we actually don't know how many, 500 to 1,000. There are very few details in the law for people to comment on. And that's to prohibit people from being able to make informed, comments on it. And again, in terms of negative effects, people in rural areas, people in poorer areas, lower socioeconomic suburbs, they're going to be particularly targeted. The Ministry of Health says, or the Associate Minister of Health has said, they're going to particularly target those suburbs. What do they mean by that? They're not going to allow any retailers there for the people who have the least resources to travel somewhere else, even over to the next suburb, who may not have a car or can't afford the buses or whatever. So that's a real nasty policy, and nobody seems to care. Very few. Ash New Zealand are expressing great concern, and that is fantastic. But otherwise, when you are down to 10%, only 10% of your country overall smoke, you got 90% who hate it, 90% who hate people who smoke. They will agree to anything punitive, anything. So it's a pretty sorry state, really, in terms of human rights, and in terms of lack of compassion for people who have a dependency on a substance. It's not a health approach. It's turning it into a justice approach. People who breach the law will risk being fined, and we already have a huge number of robberies of retail stores occurring, and smuggled tobacco. So it's not pretty here.
It's maybe a silly question, but is there anything that we can do at all to change this, or is it too late?
Well, because the current government has a majority, they're passing a lot of laws that are bringing about rapid social change across a whole range of areas. They're attacking people who own houses, people who are landlords, farmers. They're trying to shift the ownership of water supply. It's scaring a lot of people. Societies change, of course they change, but when you start to go really rapidly, and you're coming from a completely different ideology, it's very similar to what happened with Brexit and in other countries where the country splits 50-50. That's what we have here, a pretty much 50-50 split. 50% think all these rapid social changes are fantastic, and 50% feel powerless, angry, and upset.
We will certainly be following the evolution of that policy into next year, so we'll be reporting on that. I want to respect your time, so I think we'll conclude that talk for today, but I would love to ask you, can you tell people one interesting thing about yourself that's not work related?
Not work related. Well, I am a published short story writer and poet, though I haven't been able to write much poetry at all, and certainly no short stories for a very long time. I wanted to be a fiction writer, but I ended up being a scientific writer. So, you know, you never know where your dreams are going to take you. And the other thing that I share on Twitter is photos of our sheep. And, you know, I really didn't know anything about sheep, but there were 4 at the property we now live at, and just to eat the grass. And then some friends gave us some of theirs that because they were moving. And one of them was a ram, and boy, is he a ram. We now have 20. So we have, at the moment, we have a lot of baby lambs that are very cute. And I've learned a lot about sheep and what everybody thinks about New Zealand, and the jokes about people following politicians like sheep. Sheep are not that dumb. So that I now know they're actually quite intelligent, smart, funny, and they all have characters. So I really love sheep now, and sheep are not dumb. But when people follow like that blindly and don't look up the facts for themselves, they're not behaving like sheep, worse than sheep.
I've had a contentious relationship with rams. I was headbutted by a ram when I was 10, and it was terrifying. But I forgive the ram. He was just doing what he was supposed to be doing, protecting the female. So he was just being a ram. But I didn't know that about you. That's fascinating. Could we link below to your published poetry and your work? Would we be able to do that? Can we find it?
I'll have a look and see where there might be some online. Yeah, I'll have a look and I'll let you know where they're, because that was all published in, hard copies,
right.
Hard copies, journals or books or, yeah.
Yeah, we'd love to link to it. If you can send me a link, then we'll put it below the description box. People can see your published works. Get to know a different side of you.
Yeah, and I also had some that were about smoking when I was one of those terrible, ex-smokers that became rabidly anti-smoking and hated it. And I have a few poems from that time, and I even have a couple of poems about vaping from the very early days when vaping was just starting.
So
I'll see if I can find it for you.
Yeah, it's even on topic with THR. Yeah. Perfect. Great. We'll link, if you find those, we'll link them below. And I highly recommend people do follow Marewa on Twitter. You're extremely active, and I read your tweets daily because you provide really relevant, up-to-date, interesting information. And it's global. It tends to be a global reach. It's not just New Zealand based. So we'll link your Twitter profile below as well. So we'll, I think, conclude our talk there. Thank you so much for your time. Thoroughly enjoyed your very clear and concise answers. And we'll be amplifying this recording on our Twitter platform, as well as LinkedIn, YouTube, and Facebook.
Oh, thank you very much. Great to talk with you both. And thank you so much for having me on your platform.
Thank you. And we'll talk to you soon.
Okay.
Thank you. Have a good evening. Bye.
Right.